a kratom byproduct, pseudoindoxyl. Pseudoindoxyl is a breakdown product of mitragynine, which is kratom. It goes mitragynine, which is kratom, to 7-hydroxymitragynine to pseudoindoxyl. Now, what's going on with this? Why is this suddenly becoming a topic? It's becoming a topic because they outlawed 7-hydroxy in some areas, and now they're using what 7-hydroxymitragynine breaks down into is pseudoindoxyl. And so now people are abusing this compound. This compound is, let's say, 20 times more potent than morphine. Here's the rub. Why is it such a problem? It's a problem because its half-life, the amount of time it takes for the body to metabolize, the rate of metabolism is very quick. So within 2 hours, you're already withdrawing from it. In 4 hours, it's really bad. It only lasts for 2 to 3 hours. So if you took hydrocodone, it lasts 4 to 5 hours. This is only lasting 2 to 3. So you have to keep dosing it more frequently. Its habituation and dependency is much more common. So what happens is, since it's a legal compound, you buy it at a vape shop, people run out of their legal meds, hydrocodone, oxycodone, morphine, fentanyl, and then they buy this at the vape shop. So they go through their meds that are supposed to last a month in 2 weeks. And then the other 2 weeks, they're using this, and the dose slowly increases. So I've had 2 people in the past week come in, 250 to 450 milligrams of this compound, pseudoindoxyl, a day. The good news is you can come off this no matter what happens, and you'll live, you'll be safe. Nothing terrible is going to happen to you, permanent. The bad news is this compound has a horrible, horrible withdrawal. Severe anxiety, malaise, a feeling of complete discomfort, inability to sleep, cramping, nausea, vomiting, diarrhea, sweating, hypersalivation. You start sweating and salivating at your tongue, you're sneezing, your nose is running, your eyes are running, you can't eat, you have muscle spasms in your legs, you feel horrible. There's a sense of impending doom and you feel like you're dying. People are in the fetal position, ripping the sheets off the bed, squirming around in pain and discomfort. This is when I get the phone calls. So I can detox. I could probably get you in and out of this in 5 days. The way I do it, I use secondary meds to block a lot of the spasms, the nausea, the vomiting, the withdrawal symptoms, the gooseflesh, the sweating, all the muscle cramps, the intense anxiety and craving. So I minimize all that. I flush the body out. I flush the body out over a 24-hour period, and then I begin a buprenorphine taper over 5 days, and then I stop the buprenorphine taper and use secondary meds to sort of ease yourself off the buprenorphine when I'm taking people off pseudoindoxyl. Also with this, there's sleep and anxiety problems from using it, depending on your dose and length of time. So I have to either use an anti-anxiety drug for months, 2 months, and a sleep medicine for 2 or 3 months, depending on how long you're using it. The actual use of this drug, I've only seen people using it for under 6 months. It hasn't been around that long, or it's just not that common. Call my office and I can get started. Telemedicine, anyone in the state of Florida, I could start you immediately. Just call my office, do a telemedicine visit. I can e-prescribe the meds and get you started right away.